Let's discuss about atrial fibrillation. So, as we understand from the name itself, that atria are contracting irregularly. So, coming to the definition, it's a characterized by disorganized, rapid, and irregular atrial activation with loss of atrial contraction and with an irregular ventricular rate that is determined by AV nodal conduction. If you see in this video, there is a disorganized, rapid and irregular activation of atria with loss of atrial fibrillation is the most common sustained arrhythmia, and the prevalence increases with age. We also have to remember that more than 95% of the patients who are presenting with AF are aged more than 60 years. And it is seen in men more than women. Risk factors for developing atrial fibrillation includes hypertension, diabetes mellitus, cardiac disease, obesity, and sleep apnea. Coming to some facts, atrial fibrillation increases 1.5 to 1.9 risk of mortality after controlling underlying heart disease, and atrial fibrillation is associated with increased risk of heart failure and vice versa. Like if a patient has a heart failure, then he has an increased risk of AF, and in the same way, if the patient has AF, he has an increased risk of heart failure. Then AF has an increased risk of stroke, that is almost 5-fold increase of risk in stroke. Causes of atrial fibrillation. They are divided into cardiac causes and non-cardiac causes. Cardiac causes include hypertensive heart disease and valvular heart disease. In valvular heart disease, most important is to remember rheumatic heart disease, which involves mitral valve, that is mitral stenosis is the most common, and then ischemic heart disease, heart failure, cardiomyopathy, pericarditis, congenital heart diseases, and post-cardiac surgery. It is important to remember all these cardiac causes because the most common cause of atrial fibrillation is secondary to cardiac causes. Then coming to non-cardiac causes, very important to remember the pulmonary causes, mainly pneumonia and COPD. We see most often patients with COPD presenting with atrial fibrillation. Other important causes, pulmonary embolism. And there is also hyperthyroidism or thyrotoxicosis also can cause atrial fibrillation. Excess catecholamine activity or sympathetic activity. Drugs and alcohol can cause AF. And if there is a significant electrolyte imbalance, then also there is a possibility of AF, typically seen with hypokalemia. Coming to the reversible or transient AF causes, it mainly includes acute upper respiratory tract infection, chest infections, thyrotoxicosis, acute myocardial infarction, pericarditis, pulmonary embolism, or after CABG and holiday heart syndrome. CABG is coronary artery bypass graft, and we all know that holiday heart syndrome is cardiac rhythm abnormality secondary to heavy alcohol consumption. So classification of atrial fibrillation, it is mainly based on duration. So coming to the first type is called as paroxysmal AF. The duration is less than 7 days. It is usually self-terminating and lasts less than 48 hours. Second type is persistent AF. It lasts more than 7 days and generally requires intervention to be terminated. The last type is called as long-standing persistent or permanent AF. That is AF lasting more than 1 year. It causes significant fibrosis and it is usually difficult to restore and maintain sinus rhythm. Atrial fibrillation. This pic summarizes everything about atrial fibrillation. You can download this image from our Instagram page, Medrevine. So the causes of atrial fibrillation, the mnemonic is thyroid. T stands for thyrotoxicosis. HY stands for hypertension. R stands for rheumatic heart disease, typically mitral stenosis. Cardiac causes are congenital heart disease, cardiomyopathy and heart failure. Idiopathic causes like lone atrial fibrillation, ischemic heart disease, and drug abuse. Clinical features mainly involves exertional breathlessness, easy fatigability, and palpitations. The signs of AF include irregular pulse with varying volume, pulse deficit more than 10, that is heart rate minus pulse rate is more than 10, and variable S1. ECG changes in AF, typically there is absent P wave and irregular RR interval and fibrillatory or F wave. Lastly, let's discuss about the ECG changes. As I told, very important to remember is absent P wave. So if you see here, there is no P wave. And second thing is irregular RR interval. If you see the RR interval, it is irregular. For suppose here it is different and here it is different. So there is irregular RR interval. And if you see this ECG, there are F waves. These are called F waves. So they are fibrillatory waves which are seen with atrial fibrillation. Coming to another important phenomena called as Asman's phenomena. Asman phenomena is nothing but is a special type of aberrant ventricular conduction in which bundle branch block occurs as a result of abrupt change in the length of cardiac cycle. So if there is a bundle branch block with AF, then it is called as Asman's phenomena. So as I told you, there is RR interval is irregular, and with that if there is a bundle branch block. So bundle branch block is defined by wide QRS complex. So it is showing wide QRS with RBBP pattern. I hope you have learned something from this video about AF. If you like it, then like it. And also this images I have taken from ecgwaves.com. If you need a deeper dive, you can check that website. Thank you.